Taoiseach, I was reading again the programme for government in relation to health, which I described as one of the great works of political fiction. But I'll just read the key passage, Taoiseach, because it says, "This government will introduce universal health insurance with equal access to care for all. Under this system, there will be no discrimination between patients on the grounds of income or insurance status. The two-tier system of unequal access to hospital care will end." Now, yesterday you admitted that your government had failed in relation to achieving that objective. But leaving aside that objective, I put a question to you yesterday in terms of how could you and your government approve the health service plan, the HSE's health service plan for 2016, when it itself said it was 100 million short for hospitals. So you proved funding for health, knowing that it's now already in January 100 million euros short for acute hospital needs. And when I put that question to you, you refused to answer it, Taoiseach, and you implied, oh, should the HSE looks for money more than it gets every year. In other words, Taoiseach, you're playing poker with people's lives. And I would ask you to read page 90 and page 91 of the health service plan again. It outlines there will be a growing and ageing population, greater demands on the hospital services. We've overcrowded emergency departments. Cork and Beaumont are closed to elective admissions. In other words, operations are not being done. Vincent's was described by a public representative yesterday as like a war zone, that it was unimaginable to the experience that people had to go through there, and it was the highest numbers on trolleys in Vincent's across the country yesterday. People, Taoiseach, are afraid to go to emergency departments and hospitals. A community nurse in Galway told me that elderly citizens were begging her not to send them into the emergency department in Galway. That's what's happening out there, Taoiseach, and there seems to be no realisation about that. And waiting times are getting longer, and the waiting lists, more and more numbers getting higher, because of this neglect, consistent neglect of health by your government. But in terms, and Minister Varadkar has said he's going to have to go to private hospitals and overtime to try and deal with it now in the first weeks of January. So the question I want to put to you, Taoiseach, is this. Do you actually believe the HSE when it says that it is 100 million euros short for hospitals in 2016, and knowing that there can be no supplementary estimate next year? What will the government do if there's any increase at all in activity in hospital in 2016?
Thank you.
I dealt with this question that you asked yesterday. The government have approved 13.6 billion for health services this year. That's an 800 million increase on last year. We are dealing with a situation where 1,000 beds were taken out of the system. We know the demographics and an ageing population, and I pointed out to you yesterday the increased attendances at accident and emergencies with flu-like symptoms, and the fact that there are 250,000 unused vaccines at the moment, and that people in vulnerable positions should avail of that. I also pointed out to you that the importance of having an economy that is capable of dealing with the resources for investment in medical personnel, in facilities, and in providing primary care centres which are being built on an ongoing basis, community facilities, increase in home care packages, the development of hospital groups evolving into trusts, to deal in a systematic way with providing health services of a much better kind for patients. Now, you had all this yourself, and I'm not going back. We can only go forward here. So when you say, did the government approve a budget that was inadequate in the eyes of the HSE, what the government approved was the health service plan submitted by the HSE to the Minister, and that includes, Deputy Martin, 13.6 billion euro for 2016. That's an increase of over 800 million on last year's estimate, and it means, Deputy, that you're not going to be in a position to provide all the services that you need now: doctors, nurses, medical personnel, specialists, facilities, expansions in hospitals, accident and emergencies, and all of these things, without having an economy that's capable of providing those resources. We had all of that before, Deputy. where you had an endless pot of money thrown at a system that was not capable of dealing with it. Now, the government admitted that we've not been in a position to introduce universal health care or universal health insurance. And what the government are committed to is a universal health care policy driven through the primary care centres, through communities, and an expansion of facilities in hospitals. As you know, 750 extra nurses have been recruited, 300 consultants and specialists in the last number of years. But you've got to have the capacity to be able to employ those people and the resources to do it. And that means that, of course, there are difficulties. There are difficulties in many cases with patients and people who have to attend at hospital for one reason or another. And I understand the difficulties and the stress and the pressure that that causes, not just on the frontline staff, but on the patients themselves. But I'd remind you that it is 13.6 billion for 2016, an 800 million increase on last year. And what I'd like to see here is that over the next number of years, that you set out a multi-annual budget for the health system, which will make it much more structured than on an annual basis, that you can plan in a much better way for treatment of patients in whichever sector, community, home, hospital or whatever.
But Taoiseach, you don't do any of that. I mean, there wasn't an 800 million increase, because the supplementary estimate at the death of last year was 666 million. In other words, you had left it short last year at the start of the year. So it's less than 200 if you add it up. And the HSE is saying, quite simply, in summary, when account is taken of the 215 costs of services, expected cost growth, initial cost savings, there's a preliminary shortfall of 150. They'll do some cash management exercise to bring that to 100, but they're saying there's 100 million short, and they're saying one of the options will be cuts in health services. The frightening thing about the report, Taoiseach, on page 91, day case activity will be delivered at 100% of 215 levels. Emergency inpatient activity will be delivered at 100% of 215 levels.
Question, please.
Now, the population is growing. They're predicting increased demands on our hospitals next year. We all have to accept that because of ageing population and a growing population. Population will increase by 1%, numbers of older people 3.6% over 65. But there is no provision in this estimate for any additional activity. So children with scoliosis, who are already waiting too long for their operations, will be waiting longer next year. And other people, cardiac patients, people with a whole range of conditions, will be waiting longer or may not even get their operations next year if your policy continues.
Thank you.
And we need honesty in this debate about health and about services in our country. Because if there's a medical manpower crisis, you talk to doctors, you talk to nurses, acute healthcare staff, they're under enormous pressure, Taoiseach. And this is fraudulent and false, what you're doing with the health budget. You're pretending there's enough money there, when you know in your heart there's not enough money there. And you will use language to camouflage, to get you over the next 5 or 6 weeks. But what will happen in the rest of the year? Because I asked you the question about the supplementary health budget. There can't be any next year under EU fiscal rules.
Thank you.
So how is the health service going to cope in 2016, given the degree to which you have underprovided for it, Taoiseach? Not by my analysis, but by the analysis of the Health Service Executive, whose plan you approved, knowing it was short of €100 million for hospitals.
But you to provide world-class services. You know yourself, over the years, the Health Service Executive always had a difficulty in spending the actual money that it got, but they may have claimed every year for more and more money. I make the point to you that you can't go back to a system, Deputy Martin, where you continuously throw money at a system that is not reformed, that is not able or capable of dealing with the situation that has evolved over very many years, which was set by the creation of the HSE on top of the old health boards as they applied. Now, the taxpayer is putting 13.6 billion up for health this year. Of course, you're going to have requirements for reforms and effective spend of that money. But what the important point here are the professionals who work on the front line, the consultants, the doctors, the nurses, all of these people. You can't employ them and provide them with proper facilities unless you have resources to deal with it. And we've never had that. And you won't have it unless you can develop your economy to a point where it can continuously do that. You failed in this yourself miserably and abdicated all responsibility for it. All responsibility for it. I would point out to you that in 2015 there was an extra 117 million provided to the HSE to deal with overcrowding in emergency departments. There was the reduction in the fair deal from 16 weeks down to 4, which even you, I think, would accept is a reasonable to allow for people to be discharged.
Will you listen, please? Sorry, Taoiseach, we're over time.
To allow for people to be discharged from hospital.